My name is Diana, and I'm a student at the University of Northern Colorado, nurse practitioner student. And today I'll be doing an assessment of your neck, throat, lymph system, and your abdomen.
Okay.
This is Shane. Nice to meet you. So first on my assessment, I will be inspecting Shane's neck. I'm going to be looking at his thyroid and trachea as well to make sure that it's midline, looking at his muscle and definition and tone there. I'm making sure everything is symmetrical. It is. He has no signs of masses. His trachea is midline, and there's no deviation assessed there. So next, after inspection, I'm going to do an exam for range of motion. So I'm going to have you tuck your chin to your chest, Shane. Thank you. I'm testing flexion. Put it back up. You could put it backwards. That's extension. And then put it straight. Perfect. And then can you put your ear to your shoulder? Good. And then back up. Ear to your other shoulder. Go. And I'm making sure that Shane isn't lifting his shoulders to get to his ear while he's doing that. I'm going to have you put pressure against my hand. Good. And against this hand as well. Perfect. And shrug your shoulders. Nice. And that I'm testing for cranial nerve 11. Next, I'm going to skip the auscultation portion of this and do all of the auscultation with the abdominal assessment. So I'll move on to palpation. So first I'm going to palpate lymph nodes, and then I'll move on to the thyroid and trachea. I'm going to feel for movability, the size, firmness, if I am feeling any lymph nodes. So first I will start the preauricular, and then I'll go on to postauricular. Here, the occipital, and then tonsillar, submandibular, get off of here, and then the submental at the end of the chin. I'm going to palpate for the anterior cervical, and then posterior cervical, right here. Make sure I'm getting all the way down. The supraclavicular right here, and then the subclavicular in here. Okay, are you having any pain with that? Okay, I didn't feel any nodules. I would see, are they movable? Are they not? Are they hard? Are they softer? And note the size of them. Next, I'll move on to the palpation of the trachea and thyroid. It's best to do it from behind. So with the neck, I'm feeling for any masses, any deformities, making sure that the trachea is midline. It helps if I ask Shane to swallow in finding the thyroid, and it doesn't feel abnormally large. Shane, are you having any tenderness with that? Nope. Everything feels okay. I'm checking for inflammation and making sure that the trachea is midline, which it was. So for the next part of the assessment, I'll be doing an abdominal assessment. The first thing I do, I had Shane take down the top of his gown. I'm going to make sure that he's comfortable with this and that my hands are nice and warm. I'm going to be looking at his stomach, assessing it to see the shape, the contour, if it's symmetrical. I'm going to be looking for peristalsis, if I see any movement in his belly, or caput medusa, the vasculature in his stomach. His stomach looks flat, it's symmetrical, the hair distribution is symmetrical throughout the stomach. His umbilicus is midline, so I inspected all of that. Next, what I'll do is move on to auscultation before any palpation or percussion. I'm going to be listening for vowel sounds in all 4 quadrants. Shane does have normal active vowel sounds. If I was concerned about hypoactive vowel sounds, I would listen for 2 minutes. The next part of my auscultation would be listening for bruits.
you would be listening for bruise in several different areas. You listen in the aorta, the renals, iliacs, and femorals, so I'll do that next. And what I'm looking for is any turbulence, which could indicate narrowing of the vessel. Down to the iliacs. And a little bit lower for the femorals. I'm also going to be listening for a hepatic hum in the right upper quadrant. I don't hear that. While I'm doing my auscultation, I'm going to listen to Shane's carotids for any bruise. I'll use the bell of my stethoscope. And if I had concern of any thyroid issues, I would also listen to his thyroid, which I'll demonstrate. Okay. And that concludes the auscultation portion of my assessment. For the next part of our assessment, we'll be doing percussion of Shane's abdomen. So to do that, I will put my finger down and listen as I go across. I'm going to be looking for dullness and tympany. I'm sorry if my hands are cold. Throughout the abdomen. And to find the liver borders, I'll start up high, mid-clavicular, and go down until I find where the tympany stops and it starts sounding dull. At that point, I would mark where that is, and I would go down from the bottom and work my way up, listening for dullness. When assessing for the liver borders, I want to make sure that I'm making sure that the liver's not below the costal margins, because that can mean hepatomegaly. Another part I'll percuss is for the spleen, to check for splenomegaly. So I'll start at the line of the umbilicus and work my way up towards the spleen, and I don't want to hear any dullness below the costal margin on that side either. For the next part of the assessment, I will check for tenderness on the costovertebral angle. So I'm going to have Shane sit up to the side of the bed. And examining his back, I'm going to come down and find the costovertebral angle, so at the end of the rib cage and where the spine meet, right in that area, I'm going to put my hand over and do a small thump. Do you have any tenderness there? And I would repeat the same on the other side to check for any tenderness in the kidneys and possible kidney infection. Okay, I'll have you lay down again. The last part of my assessment of the abdomen, I'm going to palpate all four corners. And you tell me if there's any tenderness. I'm going to try and warm my hands up this time. So first I'm going to start with a single hand and do light palpation throughout the abdomen to feel for any tenderness. If someone's ticklish, it's helpful to have their hand in addition to yours while palpating to make sure that they relax their abdomen. I could also ask Shane to lift his knees if that becomes an issue over palpation. The next part, I'm going to do more of a deep palpation, so I'll put one hand on top of the other and really palpate further down into the abdomen. I'm feeling for any masses, any tenderness. I'm looking at Shane's face for any grimacing or discomfort. I'll also ask him if he's having any discomfort. Are you having any pain or discomfort?
No.
Okay. I'm going to assess for the borders of the liver, so I can feel down in the right upper quadrant, lift both hands, and go a little bit deeper. It helps to start lower on the abdomen and do a rolling technique to feel for the borders of the liver, and I'm not feeling anything there. You could do the same thing for the spleen and roll up, and I shouldn't be able to feel the spleen or the liver underneath the costal angles. The next part, I will do rebound tenderness exam. So I would do pressure and quick release in the right lower quadrant. Are you having any pain when I release?
No.
No? I'll check for Murphy's sign. What I'll do is palpate underneath the rib cage. I'll have you take a deep breath. And as Shane takes a deep breath, if he's having pain or tenderness when I push deeply on there, that would be a positive Murphy sign. Do you have any pain doing that?
No.
Nope. And the last is I'll do the psoas test. So I will put my hand right above Shane's knee and I'll have him lift his leg. Perfect. And that is connecting the iliopsoas muscle. And if he is having pain in his quadrant when lifting and I'm applying pressure to his leg, that would be a positive psoas sign. That would conclude my abdominal assessment.